Maybe you or somebody you know has arthritis in the knees, hips, or other joints. Maybe you've heard somebody say that they got an x-ray and that their joints are bone on bone. What does that mean, and how do you prevent that from happening? The most common form of arthritis is caused by joint wear and tear. Our joints are cushioned by a substance called cartilage, and if not properly cared for, cartilage can wear out over a lifetime. Unlike muscles and other tissues, cartilage does not get nutrition from blood supply. It also doesn't have its own nerve supply to tell you when it is damaged or when it's wearing out. So how do we feed our cartilage the nutrition that it needs to stay healthy? And how do we keep it from wearing out? Cartilage is like a sponge. We've all had that old dry sponge that sits on the edge of the sink. You pick it up and it feels so fragile, like you could just break it in half. But then you put it in water and you squeeze it a few times and it just has new life. That is the same with cartilage. Cartilage gets nutrition from compression. Every time your joint goes through a full range of movement, the cartilage is compressed and released and new nutrition is brought in. Just like when you pump soap onto a sponge, in order to get the soap worked throughout the sponge, you have to squeeze and compress it in. That is how cartilage works, and that is how cartilage is fed. One of the best ways to feed your cartilage is to move. Walking is the best activity to provide nutrition to your cartilage every day. If you have concerns about your cartilage health or your joint range of motion, you should talk to a physical therapist. They can help guide you and make sure you are taking care of your cartilage for a healthy life of movement.